Are also looking to crack down on facility fees when it comes to medical bills. Sometimes these fees can cost patients thousands of dollars. This might sound familiar to you. You go to a hospital for a procedure and you receive a bill. On it, there's something called a facility fee. It's something the Colorado Hospital Association says is used to pay employees and keep the hospital running. But proponents of this legislation say it's a way for hospitals to add unnecessary costs for patients.
This is just basically mustache twirlingly evil villainous type stuff to just go around robbing the poor, robbing the middle class as well.
That's how Ben Lowe feels about so-called facility fees.
Usually I try not to think about it because it is obviously comedically, farcically unjust.
Last year, his son received an EEG at a hospital in Denver. He then received a bill in the mail for a couple $100s.
That seemed fair, that seemed reasonable. That's the charge after insurance.
But then a couple of days later, he says this bill showed up, showing he owed more than $2,500. None of it covered by insurance.
What is this for? We're asking.
And after a few phone calls,
they said, oh, that's a facility fee. And they explained that a facility fee is where, well, you have one bill to pay the medical staff, and then you have a second bill to pay the hospital. Like, well, it's self-evident why we need to pay the medical staff. Why do we need to pay the hospital? Like, is it because we walked through their doors? Apparently, yes.
These payments are not some extra add-on. They're not new.
The Colorado Hospital Association says these fees are typical for outpatient or same-day care at hospitals.
So a facility fee is really another name for the payment that a hospital outpatient department charges.
Julie Lonborg says the fees can vary based on the type of care a patient receives or if the patient is considered high risk. She believes more people are enrolling in high deductible health plans, and now they're noticing these facility fees.
I think that people who have these high deductible health plans are looking at their bills in a different way because they're responsible for the first couple $1,000s worth of those bills. And so they're looking more carefully, scrutinizing with more curiosity what's in their bill.
State lawmakers are looking to ban these type of fees for outpatient services, as well as add requirements when it comes to transparency for these type of fees for patients. Lonborg says the concern among hospitals with this bill is how it could impact the number of services currently done with outpatient care.
Colorado's been really successful with this, is to say, what can we move from that inpatient setting to the outpatient setting? This will disrupt all of that.
For Lowe, he supports the change in state law and says these fees are being used to add on hidden costs.
I don't know exactly where the money is going. Until somebody can give me a specific path that can be traced.
In Lowe's case, he asked for an itemized bill after he received the charge. All that itemized bill said was EEG.
So it was itemized in name only.
After weeks of back and forth, he says the hospital eventually gave him a charity discount, taking off 75% of the bill.
He asked me, does that make you happy? And I said, that makes me 75% happy.
The bill is set to go to committee next Friday, March 17th. We'll continue to follow the bill's progress for you and let you know what happens.